Okay, we're ready to finish up our vitamins. Pantothenic acid is the next water-soluble vitamin. It promotes carbohydrate, protein, and fat metabolism. Sources of it are animal tissue, whole grain cereals, legumes, and milk. Deficiencies are not observed in humans, and there are no known toxic effects. Biotin. Biotin promotes carbohydrate and fat metabolism and also necessary for glycogen formation. Sources of biotin are egg yolks, yeast, milk, soy flours, cereals, legumes, and it's also made by intestinal bacteria. Deficiencies in biotin, it's only induced when there's long-term TPN that is occurring, and there are no known toxic effects of biotin. So again, to remind you, you need to know about your 4 fat-soluble vitamins, A, D, E, and K, niacin, and B12 for your water-soluble vitamins. And we're ready to move on to the next slide. This picture just gives you some examples, shows you some pictures of vitamins, and also does, with the circles down here, demographic factors like being elderly, teenager, female, immigrants, aborigine origin, or a widower. And then dietary factors such as low iron, low vitamin C, excess phytate, excess tea or coffee, and fad diets. And then social and physical factors such as poverty, poor dentition, alcohol abuse, gastrointestinal disease, candle burning, and depression. And you can see at the points where any two of the circles overlap that they become high risk. They go from being risk to being high risk. And then at the point where all 3 circles or overlap, they become very high risk. And if you look at the 3 circles, you can take a teenager who has excess tea and coffee intake, probably low vitamin C, does fad diets, possibly has lives in poverty, and at the rate it's going, a lot of teenagers now have depression. That person becomes very high risk for vitamin deficiencies. So if you need to remember things like that, those are what put people at increased risk. The demographic factors, the dietary factors, and the social factors. And then if any of them overlap, they are even at more of a risk. So that's a good slide there for you to be aware of as far as your risk factors go. Okay, let's move on to our minerals. Minerals are inorganic elements that help the body regulate help regulate body processes and or serve as structural components of the body. Again, no fuel value. The human body is made up of 4 specific chemical elements: oxygen, carbon, hydrogen, and nitrogen. They make up 96% of the body weight, and the remaining elements are minerals, which are 4%. Even though it's a tiny amount, 4%, they're still essential for good health. And your major mineral elements are calcium, phosphorus, sodium, potassium, magnesium, chlorine, and sulfur. And we'll talk about those in more detail in a few minutes. So your recommended daily allowances or requirements. Major minerals are required in amounts greater than 100 milligrams per day, and trace elements are 100 milligrams per day. Less than 100, sorry. The function is based on the individual mineral itself, and we're going to look at the table like we did for vitamins. Minerals are generally classified as major minerals, and trace elements. Minerals found in water and in natural foods, together with proteins, carbs, fats, and vitamins. They're in the soil. They're absorbed by growing plants. And humans obtain minerals by eating plants grown in the mineral-rich soil or by eating animals that who have eaten such plants. Highly processed and refined foods such as sugar and white flour contain almost no mineral value. Iron, with the vitamins thiamine, riboflavin, niacin, and folate, is commonly added back to some flour and cereals, and then they're labeled as enriched. Most minerals occur in food as salts and therefore are soluble in water. Again, therefore, when you cook food, you should cook it in the least amount of water possible so that the minerals are not lost in the food and the water as well. When you cook in excess water and then you discard the water, you're discarding the minerals as well as the vitamins. I need to back up for just 1 second. I forgot to tell you something. Lifespan considerations for vitamins, they're needed in certain times of life, and when you can need to consider additional vitamin supplements when women are pregnant or they're lactating, and then infants and the elderly. Now, for minerals, during adolescence, calcium may need to be supplemented if the diet is insufficient in calcium. Also, then you have your pregnant and lactating women need to add calcium, phosphorus, and iron to their diet. When we talked about the food, it's recommended most of the time that you steam vegetables, and that's because you're not losing all of the vitamin and mineral value when you steam them. It's also recommended that you can use any of the cooking liquid. The excess water can be made for soups, gravies, or sauces, and that way you're still retaining the vitamin and mineral content. So also, when you have somebody who has iron deficiency anemia, they would have to increase their iron. And then people who take potassium losing diuretics, not potassium sparing, but diuretics that do not spare the potassium, might have to consider taking a potassium supplement as well. Minerals are absorbed in their ionic forms, and the amount of mineral absorbed by the body is influenced by 3 factors. This is significant. The type of food. Minerals in foods that come from animals are more readily absorbed than those that come from plants. The need of the body. If there's a deficiency of a mineral in the body, more will be absorbed. And the health of the absorbing tissue. If the absorbing tissue is affected by disease, less will be absorbed. Some people tend to think because minerals are essential to good health that more is better, but more can be hazardous. If someone has a well-balanced diet, there's going to be some normal mineral loss through perspiration and saliva, and then amounts that are excessive will be excreted through urine and feces. When they take concentrated forms of minerals over a regular period of time, however, the body cannot handle them, and toxicity develops. And an excessive amount of one mineral can sometimes cause a deficiency of another one. Excessive amounts of minerals can cause hair loss, changes in the blood, hormones, bones, muscles, blood vessels, and nearly all tissues. Concentrated forms must be taken or should be taken only under the advice of a doctor. Okay, so let's talk about our specific minerals. The first one is calcium. Calcium aids in bone and teeth formation, promotes muscle contraction and relaxation, aids in blood clotting and nerve transmission, promotes normal heart rhythm, and needs vitamin D for absorption. Some of your sources of calcium are milk, cheese, sardines, salmon, green leafy vegetables, and whole grains. Deficiencies of calcium can cause rickets, osteoporosis, tetany, and poor tooth formation. Toxic effects of calcium are kidney stones, calcium deposits in the joints and soft tissues, and it may inhibit iron and zinc absorption. Calcium is a mineral that you will have to know this chart for. Phosphorus is another mineral, the next one on the list. It aids in bone and teeth formation also. It's involved in energy metabolism, regulates acid-base balance, ensures structure of the cell membrane, and is part of the nucleic acids. Sources of phosphorus are fish, beef, pork and poultry, cheese, legumes, milk, and carbonated beverages. Deficiencies of phosphorus can cause rickets, osteoporosis, poor tooth formation, and disturbed acid-base balance. Toxic effects are low serum calcium and kidney stones. Sodium is the next mineral that we're going to discuss, and you will need to know the table on sodium. Sodium helps regulate fluid balance and acid-base balance. Remember I told you where salt goes, water goes. It regulates cell membrane irritability and regulates nerve transmission. Some of your sources of sodium are table salt, milk, meat, processed foods, carrots, and celery. Processed foods is something that you'll have to remember, especially if you're dealing with the elderly population. Remember, elderly people tend to eat cheap because sometimes it's a choice between buying medicine or eating, and they want to do both, so they buy the cheapest foods available. But processed foods are high in sodium. So if you have an elderly patient who needs a sodium-restricted diet or has hypertension or congestive heart failure, and they do not need all of that excess sodium, you have to be very specific with them about processed foods. Deficiencies of sodium are hyponatremia, nausea, headache, mental confusion, hypotension, anxiety, and muscle spasms. Toxic effects are hypernatremia, hypertension, cardiovascular disturbance, and edema. Potassium is your next mineral that we're going to discuss, and you will need to know the potassium chart as well. Potassium is responsible for fluid balance. It aids in maintaining acid-base balance, regulates muscle activity, aids in protein synthesis, and aids in carbohydrate metabolism. Your good sources of potassium are your fruits, especially oranges, bananas, and prunes, red meat, vegetables, milk and milk products, and coffee. Deficiencies of potassium can result in hypokalemia, fluid and electrolyte imbalances, tissue breakdown, cardiac weakness, and muscle cramps. Toxic effects are hyperkalemia, muscle weakness, severe dehydration, mental confusion, hypotension, and cardiac arrest. Potassium is one of those minerals that you need to know the lab values of because it is cardiac effective. And that's 3.5 to 5. And so just start getting things like that in your mind now. Your next mineral is magnesium. It's necessary for muscle nerve action, regulates carbohydrate, protein, and fat metabolism, activates enzymes, and aids in bone formation. Sources of magnesium are green leafy vegetables, whole grains, legumes. Your deficiencies are hypomagnesemia, tremors, spasms, and convulsions. Your toxic effects are hypermagnesemia, CNS depression, coma, and hypotension. Your next mineral then is chlorine. Chlorine helps regulate acid-base balance, aids in digestion as part of hydrochloric acid in the stomach. It's found in table salt, milk, meat, and processed foods. Deficiencies are rare and toxic effects are rare. Sulfur is the next mineral, and it serves as a component of amino acids, aids in vitamin, enzyme, and hormonal activity, and is part of the skin, hair, nails, and soft tissue. Good sources of sulfur are cheese, eggs, poultry, and fish, and there's no specific deficiencies or no specific toxic effects either one.